Thank you, Mr. Chairman. Thank you all for being here. I really want to focus on our ability to detect diseases, to do surveillance on diseases domestically and globally. It's concerning, and I'll submit this GAO report for the record, that 15 years after we've passed law that instructs HHS to have these surveillance systems in place, they're really not implemented, not even close. This comes on the heels of the end of Title 42 this week. Recently, New York City Health Commissioner issued a public letter to New York healthcare providers urging them to take precautions and conduct additional tests to prevent an alarming trend of diseases spreading among illegal foreign nationals arriving from the southern border. I'm submitting that for the record as well. This letter warns against polio, chickenpox, tuberculosis, et cetera. How are we addressing this? One of the problems is I'm not even sure who I should ask, because this is the problem that's brought up in the GAO report. Is it CDC? Or is it Ms. O'Connell? This is a problem here where no one seems to be in charge of the detection and surveillance of diseases coming into our country. So whoever answers is fine. But what are we doing specifically about Title 42 being ended? Where is the CDC on this?
Maybe I'll start and say we have numerous platforms of surveillance systems through our emergency departments, through our public health departments. One of the real challenges, as we've talked about this morning, has been that not all of those surveillance systems have required reporting to the CDC. So even if there's something detected locally, that we may not know it at the CDC, and we might not be able to actually then give that information back to the neighboring local health departments or across the country to say, red flag, we see something out there, you all should be on the lookout for it. With regard to Title 42, among the things that we have done and put out as we've seen infectious threats come in is our health alert networks. We've done so when there's a measles outbreak and other things. And likely what happened in New York is similar health alert networks to recognize we may have under-vaccinated people who are settling in communities, and we need to watch out for infectious threats that frankly most clinicians haven't seen yet.
I guess what I'm getting at, you got tens of thousands of people, tens of thousands of people coming across the border. Do we have CDC personnel doing what I think any American would expect the Center for Disease Control to be doing, which is, randomized testing, right? Randomized testing of wastewater, fecal matter, whatever it is. Do we have teams on the ground that do that kind of thing in order to detect, or are we completely reliant on the reporting that you get?
I'm not sure I understand the question, partially because randomized testing of what, who, and where. There are a lot of infectious and non-infectious threats, and wastewater, as you know, and we're really, I think, is an incredibly promising new diagnostic capacity, but it is not for every infectious threat, and we don't know for every infectious threat whether, if, and how it is sensitive or specific in detecting it. If you don't see a pathogen in the wastewater, does that mean it's not there? Maybe not for many of these.
Well, we definitely don't know if we're not testing it. We definitely don't know.
We don't necessarily even know what to test for, what fragments to test for. It doesn't come out in whole genome sequencing.
Maybe that's not the answer, but it seems to me there's no plan. And again, I want to submit this for the record. So 15 years later, the only thing that's been implemented by HHS is to adopt technical and reporting standards. And that is the theme that I always hear back from y'all is, well, we have reporting standards. We have our partners on the ground, whether those are local public health authorities, whatever it is, they report back. Sometimes they do, sometimes they don't. Is the CDC just some academic institution, or is it an operational institution? Here's the one glaring issue that I see in this GAO report. Well, here's the problem. There is no lead operational division with defined roles and responsibilities for implementing these statutory requirements. Who is in charge of this? Who is putting people on the ground, whether it's globally or whether it's at the southern border, where we actually have some kind of legitimate surveillance system on global pandemics or diseases?
So we at CDC work in 60 countries to prevent and work towards global health security, both in surveillance and disease detection, as well as working towards medical countermeasures in those countries. We're working closely with DHS and at their request when they need help and public health in their public health support in their entry ports of entry.
Okay, but for Title 42 ending, I didn't see anything in the administration's plan for CDC at all on the southern border. Is that correct? Or is it
We're working with DHS per their request for their public health requests.
doing what?
I think it depends on the request and it depends on the.
They haven't requested anything yet.
I would have to get back with you as to the nature of their request.
I'm
We have been
sure- I'm
working
sure-
closely
okay.
with them for the last 3 years.
Okay. I'm out of time. I yield
Yeah.
back. Thank